I just want to start by saying that the way this current federal administration is treating our immigrant community is a disgrace. And the villainizing, the othering of those who are undocumented and those who have lived in this country for some time now is disgusting. It's illegal. And we will not stand for it, and we will continue to fight for you and with you. I was asked here today in my role as co-chair of the Human Services Committee, and for me and many of my colleagues, you already heard it said, healthcare is a human right, and that's the frame that we come to this policy conversation with. We believe that everyone, regardless of immigration status, should have access to health care. And like you've all said, that shouldn't stop at age 26. It shouldn't stop at age 15. It shouldn't just be for mothers or those postpartum 9 months. It should be for everyone in our state. And a few years back, in one of the public hearings, a piece of information that will stay with me forever was someone from your coalition testifying about the fact that when they came to this country, it never crossed their mind that they wouldn't have access to health care. And that's an indictment on this country. And that's something we need to look at as a state, as the United States, on what are our values. And again, those of us here today, we value access to health care. We do believe it's a right. If the human rights frame is not what's going to get someone to support this important policy, then maybe it's the budgetary argument. And in the state of Connecticut, we know that when an emergency does happen, folks are seeking care at the emergency room. And we already pay for what's called uncompensated care here in the state. We also know that, I myself am a parent. If your child gets to a point where you need to seek care, you're going to go seek care for them. And so maybe that's at one of our FQHCs, which we know take patients regardless of insurance coverage, regardless of immigration status. So we are already paying for this in Connecticut, and when we don't invest in health care and folks aren't able to get the primary and the preventative care that they need, we're actually paying more in the long term. And so this is a smart investment to expand Husky to cover everyone in the state who qualifies regardless of immigration status. And so we will continue to stand with you. I thank you all. I've gotten nothing but positive feedback from colleagues in this building today for the advocacy that you've done. So thank you for visiting with our colleagues, making your voices heard. This is what makes change. And I just thank you all for being out there and speaking up and speaking out. Thank you.